Hello, my name is Thomas Fonseka and I'm a clinical fellow in urology. Today I'd like to present our work looking into COVID-19 and the impact on training within urology. The COVID-19 pandemic has incurred large-scale disruption to almost all medical specialties, with training in urology being no exception. With the abrupt cancellation of most face-to-face clinics and vastly reduced elective operations, training opportunities have been severely restricted. Examinations such as membership and fellowship exams, as well as national recruitment to registrar training, have also seen major disruption. To counter these complex challenges, a range of novel training methods have been developed. Virtual learning has grown exponentially and has helped keep doctors progressing. More established educational modules such as training in human factors and reflective practice have also gained new relevance. Today, I will be presenting a critical review on the effects of COVID-19 on urological training, as well as the novel training modalities that have helped education continue in these unprecedented times. Italy was one of the first European countries to suffer the effects of COVID-19 and also saw some of the worst mortality figures. Of course, this brought major reductions in urology services, with many Italian urology trainees being redeployed to help in other specialties. Around 40 to 80% of the trainees saw either severe reduction or complete suppression in clinical activity, with 40 to 60% of trainees seeing the same for surgical activity. The experience was similar at our institution, with a third of urology trainees being redeployed to intensive care. The educational bodies such as the Joint Committee on Surgical Training have made significant efforts in tailoring training assessments to adapt to the disruption. Training extensions have been made, as well as a reduction in the number of work-based assessments needed to progress. For those applying to urology training, there have been changes to the selection process to account for social distancing. The entire selection process has now been converted to online, with interviews conducted over Microsoft Teams. This has required adaptation and resilience from junior doctors to navigate what has always been a stressful time in their careers, but now with added challenges. Thankfully, many medical institutions have provided key resources to help junior doctors with their well-being during the pandemic. The British Medical Association, the Royal College of Surgeons, and the General Medical Council have all made easily accessible resources online for doctors to access, where they can find support and key information. Topics include health and well-being, guidance on personal protective equipment, and how to adapt practice to COVID-19. The urology curriculum was arguably already underrepresented at medical school, and the pandemic may have exacerbated this. With most medical student clinical attachments being cancelled at the peak of the pandemic, students' clinical exposure has been drastically reduced. Efforts have been made by medical schools to convert teaching to online platforms. This has been found to be beneficial, and for some, online lectures have been easier to access, cutting out travelling cost and time. Virtual learning has not just benefited medical students. It has been found to be of value across the entire medical workforce. In urology, it has been used effectively to maintain training despite the lack of hands-on practice. Virtual lectures, webinars, and online journal clubs have been found to have positive results. These platforms can not only maintain training, but also some sense of normality in times of great change. This has been well received by trainees. Surgical simulators such as laparoscopic box trainers are also simple devices that can be used at home. More senior urology trainees have found that these devices can prevent loss of hard-gained laparoscopic surgical skills. Virtual conferences such as this one also have major benefits in widening access to education. We have seen an exponential rise in the number of virtual conferences since the pandemic, These conferences not only provide platforms to disseminate key knowledge and research, but also allow those who may not have been able to afford the exorbitant travel and attendance costs of international conferences to attend virtually and benefit from learning. Of course, the face-to-face interaction and networking cannot be replaced, but a number of conferences even have sections specifically for networking, such as virtual coffee lounges, as well as exercise classes and well-being sessions. Another benefit of virtual platforms is that well-established courses can be made online and therefore allow more access to them. Training in human factors and non-technical skills is fundamental to developing surgeons with the right skill set in theatre. Personal protective equipment, or PPE, has caused significant challenges to operating. Trying to carry out procedures in surgical hoods which reduce peripheral vision and masks that muffle voices is challenging. This has required a new level of awareness in non-technical skills. The Royal College of Surgeons have made their popular course on non-technical skills for surgeons freely available online. This has empowered and equipped surgeons to face the challenges of operating in PPE. Reflective practice has also been of great benefit in consolidating lessons learned. At a time when one-to-one training has been sparse, being able to use tools in reflective practice has enabled trainees to continue learning from their experiences. We have found that this has been of particular benefit to those who have been redeployed to other specialties. Being able to reflect on lessons learned has allowed us to consolidate new skills, and we hope will lead us to becoming more rounded surgeons of the future. In conclusion, we have found that COVID-19 has caused major disruptions to urological training. Amongst the challenges faced, novel training methods have emerged, and the positive aspects of these are likely to remain with us beyond the acute phase of the pandemic. Virtual training, simulation training, human factors courses and reflective practice have been pivotal in maintaining education through these difficult times. We hope these learning modalities will continue to flourish moving forwards. Thank you for listening.